Hey everybody, it's Dr. Galvin with another COVID update. Boy, poked a hornet's nest with that last video about Dr. Stock and his claims at the school board meeting. The haters are out in force, lots of very friendly comments, especially on YouTube. So I thought today we would go through the papers that Dr. Stock is referring to. Remember he talked about the flash drive? Well, it turns out the Hancock County Patriots are hosting a list of those papers, and I've looked through all of them. And not surprisingly, don't say exactly what he implied. Now, before we get started, since there's been lots of questions apparently about my qualifications and things like that, I'm going to give you a little background about myself. My name is Jeffrey Galvin. I'm board certified in emergency medicine and obesity medicine. I've been a practicing emergency physician for well over 20 years. I've also opened a functional medicine clinic, precision medicine, where we do evidence-based medicine to get to the root cause of disease. And we've been running that for about 10 years, but I still work in the emergency department. I've been working since this started, and I've probably posted 150 videos at this point, many of them after ER shifts, kind of giving people updates. Now, what does that mean I'm a board certified emergency medicine physician? Well, just to give you a little bit of background, that means I went to college for 4 years, where I got a biology degree with a minor in history. I then did a year of research, of clinical academic research. Then I did 4 years of medical school. After that, I did a year of internship, learning the basics. And then I did a 3-year additional training in emergency medicine in Boston. So 4 years total of postgraduate training. After that, I spent some time in as an emergency and trauma specialist in the Air Force. Moved to this area about 15 years ago and have practiced in emergency departments and in my clinic, which I opened about a decade ago here. So I see both patients in my clinic and patients in the emergency department. So sometimes when I'm talking about COVID, I'm talking about patients I've taken care of as a primary care doctor, but many times it's because I've taken care of them in the emergency department when they come in very ill. Now remember, as an emergency physician, I take care of things acutely. So a lot of times I don't have a lot of background about what's been going on beforehand, and I'm very unlikely to have any follow-up with the patient afterwards. But just to kind of put it out there, and that's my credentials. We have a YouTube channel, Facebook, all that stuff. So if you happen to like this, subscribe, the normal, the spiel. So let's get to these papers. I'm just going to go through them numerically. Again, I'll put a link to Dr. Stock's list of papers from the Hancock Patriots site, so you can follow along. The first study was a study about Marine recruits, and basically it showed there was some transmission when they quarantined them in barracks, and the majority of that transmission was amongst roommates or in small groups. So I guess it means that study says you can catch COVID from other people. I don't quite understand why that's useful for his points, but he put the study there. The second one, it basically is a study that shows that there's broad and effective immunity that persists after getting COVID. So if you get infected, it looks like you have a broad and effective immunity, which is the argument for developing vaccines. So again, I don't see how it plays to his point, but these are his papers. You can read them yourself, and if you disagree with the conclusions, please put them in your comments. I'm sure that you will. The number 3 study is a retrospective study about vitamin D. It doesn't have anything about COVID. It just says that vitamin D may be helpful in respiratory illnesses, which we've known. I'll give him that one. It seems like it's a legit study. It doesn't say anything about COVID, but it does talk about vitamin D helping with viruses. Number 4 was a study about face masks. Retracted. Why was it retracted? Because the author lied that he was writing for the NIH and lied that he was a member of the staff at Stanford. So that was retracted. So you can't use that study. Number 5 was a CDC report that showed masking and hand washing was marginally effective against the flu. And saying that it's a part of the mitigation strategy, but the conclusion was vaccines are the cornerstone of seasonal influenza control. So masks and hand washing are a little bit helpful. They don't work by themselves, and I don't think anybody's saying that that's the only thing that's going to help. Vaccines are the best thing for the flu. Number 6 is an opinion article from a right-wing newsletter. It's not a study, so we're not going to give it the grace of that. Number 7 is a really great study, and I don't know why I even included it, because it basically shows lower COVID rates in every county that had a mask mandate. The primary point is that you need to do other things as well, just like the previous study, but masks need to be a component. So again, it actually goes opposite of what he's saying, but these are his studies, these aren't mine, and so that's what he said. Number 8 was the Great Barrington Declaration, which basically says that lockdowns are harmful, and I don't disagree. One of the things the Great Barrington Declaration says is that it lowers immunization rates, so vaccination rates among kids go down, higher cardiovascular death, depression, anxiety. We learned that lockdowns are harmful, and we've got to balance basically the harm of the lockdown versus the harm of the disease. And I don't have I agree with that declaration. It doesn't say anything about masking. It doesn't say anything about vaccinations. It just says lockdowns are potentially harmful, and I agree. Number 9, basically a study that shows that you can get breakthrough COVID infections if you've been immunized or you've had COVID. Yeah, we know that. Again, just sort of common sense, but he put the study there at 10. This is number 10 is another vitamin D study. It showed improvement of survival in the hospital with vitamin D. Good, although observational. So you can't really attach causation to observational studies, but there's some other studies about vitamin D that he quotes that I think, we think that vitamin D is helpful in the hospital setting. So we'll give him that one. Number 11 was a study that purported to show kids suffering higher levels of CO2 if they use masks. Again, retracted. Why was it retracted? Because the authors could not demonstrate that the device that they were using to measure CO2 actually measured CO2. So they had to retract the study. Got to throw that one out. Number 12 and 13 are both additional vitamin D studies that show improvement in hospitalization recovery rates and also diminishment of ICU visits for people that got vitamin D. And again, very good studies. I think that they're fine. We know that vitamin D plays a role. I sent out a supplement sheet of just general things you can do, and I'll put a link to it if you want it. I've been sending that out since April and updating it, and vitamin D has been a cornerstone, April of 2020. Vitamin D has been a cornerstone since we did it. But, Dr. Stock is implying that vitamin D is a cure. It absolutely is not. There's not a single study that implies that or shows that, but it's certainly important, and you need to have adequate vitamin D levels for a lot of different reasons. Number 14 was this Danish mask study that basically looked into seeing if not using masks, but recommending masks were effective. There's so many flaws in the study because they're just making a recommendation. They never followed up with people to see if they actually use masks. They didn't. It was their conclusion was that recommending masks are moderately effective in a community that has moderate COVID penetration. I don't really think. Read the study. I mean, tell me if you can make heads or tails, but I don't think it shows anything. It doesn't support or contradict what he's saying. Number 15 is another study on the community use of face masks. The conclusion, mask mandates dropped cases of COVID by 200,000. I don't understand why he chose this one. It actually disproves his point. But again, I didn't pick these studies. These are his. Number 16 is the same number 4 that's retracted about the face mask one where he lied about being with the NIH. Number 17 is a study about individual fatality rates that shows basically that your risk of dying goes up as you get older, which we knew that your risk when you're young is pretty low. It steadily goes up. They kept nursing home patients out of that study, but basically the individual fatality rate rises with age. Okay, I'll give you that one. Number 18 and 19 are the exact same study. You probably just made a little error there. It's a meta study that shows that mask wearing protects others. It's questionable whether it prevents people from getting infected, but essentially saying more studies needed. And the conclusion was masks work, but they won't solve anything on its own. And I think we've seen that multiple times in these studies, is that they're showing effectiveness of masks, but not by themselves. Vaccination, distancing, staying home when you're sick, washing your hands, being smart, being a good neighbor. Those things all play a role in community mitigation of outbreaks. Number 20 is this Provincetown, the Barnstable County study in Massachusetts, which he completely botches. I'm sorry. So let's spend a couple minutes on this one, okay? What we found was, and there was a CDC report, people got on me because I linked to an NPR story. Well, the NPR story was about how they actually got to the point of doing this study. And it was a neat little piece of detective work. And I'm sorry if you guys don't like NPR, but read the story. It's just about how they came up with this. But essentially what we found was that there were about 469 cases of COVID in a mass gathering in Provincetown, Massachusetts on the 4th of July. It's a huge party weekend in Provincetown, and estimates are there were about 60,000 people there. 95% of them vaccinated. So massive amounts of vaccination. From reports, if you read about people that were there, it was a rainy weekend. Lots of people were inside, close together. The bars apparently were shoulder to shoulder. It was absolutely jam-packed together. So you got all these people who are jam-packed together. And at the end of it, about 469 of those vaccinated people ended up developing symptoms of COVID. Mine largely mild, although it did result in 4 hospitalizations. So it sounds pretty bad because the headlines all say 74% of vaccinated people got sick. Well, unfortunately, you're falling prey to the base rate fallacy. So you have to look at the base rate in order to interpret the numbers. So we're talking about 469 cases out of how many? Well, if 95% of the people were vaccinated, that means about 57,000 people were vaccinated and 469 people got sick, which is what? About a 1.3% rate of infection in vaccinated people. But, there were also people that were unvaccinated that got sick. What was the rate there? Well, it was 8.3%. So what that study shows is the vaccines give you 6 times more protection than being unvaccinated about getting infected. About 0.8% of those people were hospitalized. Now, what's the typical hospitalization rate for someone who's unimmunized with COVID? 5 to 10% probably. I think 5% pretty much everybody would agree with. There are some people that think it's a little bit higher, but let's use 5% versus 0.8% in the group that was vaccinated. So that Barnstable County study shows that the vaccines are highly effective. And if you want to know about the base rate fallacy, there's a great TikTok by Dr. Kat, who's an epidemiologist, and she does a 1-minute explanation of how you can get tripped up by that. And it's great fodder for headlines, but it's not factual when you see things like that. The next study, number 21, was a study on short-term use of high-dose vitamin D in COVID. Again, shows potential benefit. Again, I'm not arguing that vitamin D can't be helpful. I would argue that it's not a cure. Number 22 is not a study at all. It was just a letter written by a couple doctors that said, homemade face masks probably aren't very good. And I think he's probably right. They're not as good as N95s. So anyway, let the flames begin. I'm Dr. Galvin. I'm going to post this here today. Those are the studies that Dr. Stock himself referenced. They were on his flash drive. I don't think they prove, or they even largely support anything that he said. There's some evidence that vitamin D may be helpful. He didn't really provide any studies at all that show that masks are ineffective. All the studies that he showed basically said they're at least partially effective, but probably not alone, which I don't disagree with. Again, I'm Dr. Jeffrey Galvin. Please like and follow if you find this useful. I've been doing this for a long time. I think we have about 150 videos up. If you look at our YouTube channel and our Facebook channel, you'll find them. Have a great day. Wear your masks. Stay safe.